Hello, in this video I will talk about rhinoplasty, which is one of the most commonly performed cosmetic surgeries today, and its effects on our most vital function, breathing. I will also discuss the importance of addressing both aesthetic and functional problems of the nose together. If you are also planning to have a nose aesthetic surgery, I think this video will interest you. The nose, which is a very prominent anatomical structure in terms of aesthetics, also plays a very important role in the body's most vital function, breathing. For the oxygen in the air we breathe to pass into the blood in the lungs in the ideal way, the air needs to enter our body through the nose and be filtered, warmed, and humidified inside the nose. When mouth breathing is constantly performed due to nasal congestion, problems often arise as infectious agents and harmful particles in the air, along with air that is not at the appropriate temperature and humidity, enter our body. In the long term, diseases such as high blood pressure or heart rhythm disorders, which develop as a result of reflexes triggered by insufficient oxygen transfer from the air to the blood, can also be observed. In repeated nasal surgeries, achieving good results both aesthetically and functionally becomes increasingly difficult. For this reason, it is very important for our health that the first surgery to be performed on the nose is successful not only aesthetically but also functionally. As a result, rhinoplasty surgeries should be performed in a way that does not disrupt the vital functions of the nose, or, if there are existing problems with these functions, they should be identified beforehand and corrected during the same operation. Nowadays, especially in primary, that is, first-time rhinoplasty surgeries, we mostly reduce the size of the nose, and as a result, the airway inside the nose also becomes somewhat smaller. For this reason, conditions inside the nose such as septal deviation or enlarged turbinates, which may not cause significant breathing problems before surgery, can lead to nasal congestion after the operation. At the same time, if the cartilage in this area is excessively reduced in order to make the tip of the nose smaller, collapses can be observed in the side walls of the nose, which become more pronounced during breathing and cause nasal obstruction. For a nose surgery to be successful not only aesthetically but also functionally, that is, for patients to be able to breathe and smell comfortably through their nose after the operation, it is necessary to identify and, as much as possible, address during the same surgery any existing internal nasal cartilage and bone deviations, enlarged nasal turbinates, anatomical variations such as the presence of a large air cell called concus bullosa within the middle turbinate structures, and functional problems like chronic sinus infections before the operation. Although examinations we perform visually or with the help of endoscopes during the preoperative evaluation of patients scheduled for aesthetic and functional nose surgery provide important information about the nature of the problem, it is not possible to fully assess certain anatomical areas inside and around the nose using these methods. In order for the surgery to be especially successful from a functional standpoint and to prevent the need for repeated surgeries in the same area in the future, a radiological evaluation of the nose and surrounding structures should also be performed during surgical planning. For this purpose, the examination that provides us with the most information is the computed sinus tomography. With the tomographic evaluation to be performed before surgery, it is possible to identify and address variations such as concus bullosa and large sinus cells, which, if resolved in the same operation, will have a positive effect on surgical outcomes, as well as pathologies like chronic sinusitis or sinus masses that could require additional surgeries in the same area later on, and to resolve these issues during the same procedure. In conclusion, for a successful rhinoplasty, it is just as important to correctly understand the patient's aesthetic expectations before surgery and to plan the operation to meet these expectations, as it is to identify all existing and potential functional problems beforehand and to plan and perform the surgery in a way that addresses both aesthetic and functional issues. You can also share your opinions and questions on this topic with me by writing them in the section below the video. Don't forget to subscribe to my channel to follow similar videos I share about ear, nose, and throat diseases and facial aesthetic surgery.